How many of you have been told that you have gum disease? You know, anybody that goes to the dentist, gets their teeth cleaned, and the next day they have the flu? Hi, my name's Oksana PDA. I spent 42 years as a dentist, the last 30 years as a holistic dentist. And now I retired into a wellness practice, got my Doctor of Integrative Medicine, and I apply both. So they call me the health detective. And I'm here to tell you that gum disease is a full body infection. So thank you for listening in today. I'm sure that there are other things you could be doing, but it's people like you that make a difference in the health of your families and, of course, yourself. And you will learn that not only gums are involved in the infection, that gum infections are contagious, that they are just like the flu, and that gum infections are precursors to many other health problems like heart disease, arthritis, diabetes, Alzheimer's, even cancer. That gum disease is not just your fault. And most important, that gum disease is curable, not just controllable. I'll tell you a little bit about my background. I was a dentist for 42 years, as I mentioned, 30 years holistic, and my goal was to do no harm. So I stopped using mercury amalgams, I stopped doing root canals, and I stopped cutting gums away. In 1979, a guy by the name of Trevor Lyons rolled into town on his motorcycle and taught us how to put plaque under a microscope and identify what we were seeing. That changed my life. He had based his research on Dr. Kai's and Dr. Barkley, and he had perfected the process of finding plaque, live plaque, under a microscope and seeing what was there. And he found that there were only certain things that he found under a microscope that caused destructive gum disease. And it wasn't just bacteria. It wasn't just fungus. It certainly wasn't a virus. Guess what it was? A parasite. In North America, we don't have parasites. It's only the ones that are in the tropical countries. Well, I now have a microscope. I am able to identify the various things that I find and how they affect the gums. So after I retired from dentistry, I went into integrative wellness, and I teach non-dental practitioners how to look in the mouth and recognize some of the things that are causing their clients not to get better with all the things that they offer them. So I solve mystery syndromes also for my clients by finding the root cause. The root cause sometimes is right here. And MDs, naturopaths, other holistic practitioners, they know nothing about this. And they get frustrated because their supplements aren't working, or the infection isn't going away, or whatever. So, what is an infection? Wikipedia says, infection is the invasion of an organism's body tissues by disease-causing agents, their multiplication, and the reaction of host tissues to the infectious agents and toxins they produce. Infectious disease is also known as transmissible disease or communicable disease. And it's an illness resulting from an infection. So, classic symptoms of an infection, everybody knows, is redness, swelling, pain, and eventually pus. It destroys bone, it destroys skin, it destroys joints, nerves, organs. It can cause fever, fatigue, and discomfort. The signs of a gum infection are the same, but you can also recognize it a little bit faster because you use this part of the body all the time. And you add to the various things that the infection description said, you add bad breath, you add salty taste or badly sweet taste, feelings of something getting stuck in between your teeth all the time, eventually receding gums, and the last stage is loose teeth. And when I sit across the table from somebody and I can smell their putrid breath, I don't need a microscopic slide to tell me that that person has amoeba in their mouth. And usually that amoeba is being fed by heavy metals like mercury. So if you have bleeding after a cleaning, your gums are infected. And you should not be having them cleaned. That will push the bacteria into the bloodstream and circulate it through your body. Well, if it's an amoeba, that's even worse. This is why people quite often feel like they have the flu after their cleaning. So, wouldn't brushing do the same harm? It does. And this is why I get very, very upset with dentists who say, brush harder, get that floss down there, use Listerine, use Colgate Special, whatever. When I hear that, I try to be very gentle with them because they have been programmed for many years that this is the best product. But commercial toothpastes have sodium lauryl sulfate. They often have isopropyl alcohol. They have fluoride. Fluoride burns gums. The isopropyl alcohol burns gums to the point where you can get cancer. And they do nothing to kill amoeba. They will kill some of the bacteria, but they also kill you. So, can we see why gum disease is a bit of a dangerous infection? 87% of adults in North America have gum disease. And 80% of those have a parasite. Not a virus, not a bacteria, not a fungus, but a parasite. It's called Entamoeba gingivalis when it's in the mouth. It is called Entamoeba histolytica when it's in the stomach. It's called something else Entamoeba when it's in the feces. But it's an amoeba, and it causes an infection in the gums that eats the attachment between the gum and the tooth, just like a little Pac-Man, because it wants to produce white blood cells. White blood cells are the food that an amoeba eats. And what do white blood cells do for our immunity? We need them, right? We lose them to the amoeba. They take the nucleus out of the white blood cell and take the hemoglobin off our red blood cell, leaving us tired and immune compromised. So once the attachment is compromised, the teeth will eventually get loose. But when we swallow or breathe it in, it lands in our lungs, read pneumonia. It lands in our heart valves, read bacterial endocarditis. Read landing on pancreas causes diabetes. It lands on the colon, causing diarrhea, IBS, Crohn's. It lands in joints, causing arthritis. Does that sound like just a gum problem? This is not to say that bacteria, fungus, and viruses do no harm. Of course not, they do. Spirochetes have been implicated in Alzheimer's. And the spirochetes are the first bacteria that shows up when your oral hygiene slips. Many of the bacteria have been found in joints, in arthritic joints, and in heart disease. And there's a simple process of identifying this, just putting some plaque under a microscope. It's a phase contrast microscope that shows clear things in a clear liquid, and you can identify it and take care of it. And it's so easy that anybody trained in microscopy and microbiology over a weekend can learn to do this. Yet we go to the dentist, the very first thing that's done in a dental office is cleaning. Whatever is in your mouth then easily goes in. That's why cardiologists ask for dental consults before heart surgery. However, many dentists don't do a slide. They just say everything's fine. So what I have been suggesting to cardiologists is put the person on metronidazole, which is an antiparasitic, before your surgery for 10 days. Just blanket it, because that's all they're going to use, right? So just to give you an example of what can happen. Steve, a friend of mine, came to me for a second opinion. Oksana, my wisdom tooth is hurting and the dentist wants to do a root canal. So I looked in, and not only was the tooth abscessed, but the gum around it was very infected. And I said, Steve, be careful. This is on your heart meridian. You are a pilot. You can't take chances. He went away, and I didn't know what happened. 2 years later, he calls me and says, Oksana, you were right. I said, right about what? I am just out of surgery. I've had open heart surgery to replace my valve from bacterial endocarditis. He had gone back to his dentist, had the root canal done on a wisdom tooth, which is really senseless, and had never had the gum disease taken care of. Lost 2 years of his career and a lot of his vitality and vivaciousness. I hate to be right. When it means that somebody else could have been saved such a fate. So what do you do differently now that you have this information? Avoid cleanings until you know you are infection-free. Seek out a dentist who knows how to eliminate the infection before they touch you. Herbal protocols are my favorite, and many dentists prefer the antibiotic route. In that case, the antibiotic of choice is metronidazole, like I mentioned. But do not let your hygienist or your dentist touch your gums until you are free. In our clinic, we use herbal protocols, which is something I've developed, and non-toxic products, black walnut tincture, essential oils, wormwood, cloves, and these are much less painful, much cheaper, much more effective than the surgery that periodontists want to do all the time. And another modality that I love is ozone. Ozone is nature's antibiotic. So I challenge you to seek out better and more effective ways to treat your infections the integrative, holistic, and natural way. Thank you for your attention.
To receive.
Oh, thank you.
That's why I know you.
Thank you.
Oksana, that's why I know you. I've read some of your work. I'm in Vitality Magazine. and
Okay.
I've read your work, and